Hello, everyone, and let me welcome you to our class, which is your Community Health Nursing RLE. Now, let me discuss to you your population-based approach to community health nursing. So, what does it mean? Okay. So, by the way, my name is Professor Cherry Ann Garcia Durante, and if this is the first time that you've seen me, so I am one of the professors here in University of Perpetual Help, and I finished my master's in the University of the Philippines, Manila, my bachelor's degree in St. Louis University, Baguio City, and currently I am taking up my doctorate in genetics. So, with that being said, let me discuss to you the population based approach to community health nursing. Okay, so what do we mean when we say population based approach to community health nursing? Now, there are different ways to do a community diagnosis. You can have what we call as your problem focused approach, and then we have what we call as your population based approach. According to your book, it is uh, has a focus based on entire populations possessing similar health concerns or characteristics. Now, when you talk about the population or your community, so there are similarities in terms of your characteristic as a community. So, because of that, you can get, like, let's say, a sample of that community to represent the entire population. Okay, so because of the similarities in characteristics. For example, you are living in an urban area. So in terms of your community, so most people in the community is or has, for example, a middle or lower middle class in terms of socioeconomic status. So that is where your similarities would lie. For example, you're living in a subdivision. So the community, the people inside that subdivision somehow has some characteristics in common. Okay? So that is what we are targeting when we talk about population-based approach. It is based on an assessment of community needs. So although this is not a specific problem, not a specific individual. So although there is a population-based individual focus, when we talk about your population-based approach, we're talking here about looking at the community as an entity, not just one person. Okay, so I hope that you're getting what this means. Now, it addresses the broad determinants of health. When you talk about determinants of health, it just means that there are so many factors that affect health. Now, let me show you some of the social determinants of health. So, an example of this is your economic stability. That's the reason why I told you, where do you live? Do you live in an urban community or a rural community? So, your economic stability has something to do with your social determinant of health, which means that it affects your health. Let's just take, for example, this pandemic. Obviously, you will face this pandemic differently if, let's say, for example, you live in a subdivision, in a gated community, as opposed to, let's say, you live in an area where the houses are slummed together. Or let's say, for example, in a very small space, there are about, two families living there. So how can you practice social distancing? So there is where, that is the reason why your economic stability somehow affects your health. So there is obviously an increased risk for those people who are not able to do some social distancing. So let's say, for example, you're, let's say, 12 people living in a small house. So how will you practice social distancing then? So that will be very difficult, and that will affect your health. So that's the reason why economic stability is a determinant of health. Another is social and community context. So when we talk about that in terms of determinant of health, let's say, for example, what is the context or the environment that you live in, or the context, let's say, of your community? So is it a community, let's say for example, is it a community that decided to live together? Okay, so are you in a compound with your family? So that can actually affect your health, right? So you will be obviously very protective of people coming in, because this compound is like, lived in by people that you love, so that can be your community context. Or for example, culture can also affect your health. So are there beliefs or belief system inside your community that is not held by, let's say, others? For example, do you believe that spirits cause diseases? Is that does your community believe in that? So if that's the case, then probably you will not even do or use your mask or something, because you believe that it's just spirits that causes these diseases and not viruses. You don't believe in that, so that will affect your health greatly. Okay, another is your neighborhood and environment. So we've been talking about this. When we talk about environment, it talks about your geographical location. Are you near hospitals? Or, for example, in my personal example is when I go to tribal communities and they are very far from the nearest hospital. Now, it would take 1 day walk for you to be able to just go to the hospital. Now, would that affect your health? Obviously, it would. So these are actual determinants of health. In my experience, in terms of medical mission, we see this people deprived of the primary healthcare just because they're far from the nearest health centers or rural health units. Another is in terms of healthcare. Is healthcare available for you? Do you have insurance? So this plays a factor in terms of your personal access to health or your community's access to health. Another is education. So your educational attainment um somehow affects your perception of health. So what is healthy? Do you believe in, let's say, superstition, or do you believe more on science? So this actually affect how you view health. So technically, all of these things are considered when we talk about population-based of focus, or population-based approach in community health nursing. So you will not just target, let's say, so when you do your intervention, for example, you have come up with a way to help the community. Let's say, for example, I want to help the community by establishing, let's say, gardening. So a garden in every home, vegetable gardens. So that is your vision, or that's your implementation. However, if you look at the neighborhood, there are no land area for you to plant anything, for example. Or for example, they are living in condominiums, so it might be very difficult to plant a vegetable garden, or grow some flower, or rather fruit trees for these people. However, maybe you can adjust your plan to accommodate the neighborhood by, let's say, what about container gardening, or vertical gardening if there are no land areas? So these play into these factors, these determinants play a role when you approach a community. And what community are we talking about? So these factors are very important when you plan and also implement the interventions that you want, let's say, for example, to address the community health problems. Okay, so I hope that you get a glimpse of what social determinants of health are. So in my master's degree, I actually took a whole semester of class on determinants of health. So this is a wealth, this is a wealth of knowledge. So however, later on we will have an activity on determinants of health. So I'm excited for that. Okay, so population-based approach considers multiple levels of practice, which means that several focuses of practice can be applied in population-based approach. Another, it considers multiple levels of prevention. Now, because you're here in Station 2, rather in CH and RLE, I believe that you have already gone through the different levels of prevention, like primary, secondary, and tertiary. So I know that you know that already. So obviously, all of these things are being considered when we go to the community and give our interventions. Okay. So what about multiple levels of practice? Let's go deeper into that. So, one level of practice is what we call as your individual focus or family focus. What does this mean? It means that your goal, okay, if this is what you're considering to, let's say, to focus on when you do your community health nursing, is you're trying to implement change in the knowledge, attitudes, beliefs, practices, and behaviors of individuals or families, which means that you have now identified people inside the population who are at risk, and you're targeting them with an intervention. Let me give you an example. For example, you have an intervention for lactating mothers. So let's say in your situational analysis, you have figured out that not let's say a very small percentage of the population that you are trying to intervene, or rather you're a community health nurse in. They are, let's say, the lactating mothers are very small in terms of the percentage. So most mothers do not want to nurse their children. They don't want to breastfeed their children. As a nurse, you know that breastfeeding is very, very important, and it's mandated by the law actually, right? For breastfeeding to occur, especially if the mother is confined in the hospital, they are mandated by law to actually breastfeed and not, offer the formula milk. It's under your milk code. Now you're now thinking that this population is where I want to change their behavior. I want to change their attitude towards breastfeeding. So you come up with an intervention, let's say a health education seminar, about breastfeeding, like the benefits of breastfeeding and all that. So you have focused this with the people in the population that are at risk. So you want to change the behavior of these individuals. That's why it's individual focus or family focus practice. Okay, so I hope that you're getting that level of practice. Another level of practice is population based community focus practice. What does this mean? That your intervention is somehow, or what you want to change with the implementation of your intervention, is the cultural norm within your target population. Okay, so the community attitude, the community awareness, the community practices, and community behaviors. So let's say, for example, you want to integrate, so you've seen that in this community, they are not practicing social distancing, for example, and you want to integrate that. So let's say you come up with a webinar on let's say social distancing and COVID. So you want to inform the entire community about what benefits are there if you do your social distancing, and why it is a must for you to follow this guideline. So this now targets the entire community, not just an individual person who is not following the rule. So you're targeting the entire community because you're focusing on their norm or on their belief. So if, for example, let me give you another example. For example, the community does not believe in vaccines. And obviously, you know the importance of vaccines and vaccinating children, um, because of course those diseases that are already eradicated can now come back if children are not vaccinated. So for you to be able to change the entire community, so entire population within the community's mindset. Let's say that vaccinations are harmful to children, then you will, you can, let's say, you can do an interview of experts. Okay, so like a talk show and or a panel, and inform. And in this interview, this talk show, you have an open forum for those who are asking questions, so from the community. So these interventions are targeted to change the whole community's perspective, not just one individual or one family member or one person or the people at risk. Okay, so you're targeting the entire community's mindset. Now, the last level of practice is what we call as your systems focused practice. What we're talking about is you're trying to change systems that affect health. When we talk about systems, this has something to do with health policies. According to this, organizations, policies, laws, and power structures. So obviously, there are health policies that affect uh, our health, or that affect rather our health system per se. So if these are the targets of your implementation in terms of the community, let's say for example, you want to influence your barangay officials to, let's say, have a barangay ordinance about certain health determinant. Let's say, for example, street foods, the proper handling of street foods. So let's say, for example, before you want to influence the barangay officials that before vendors can sell their street foods, they have to undergo a seminar or a workshop on food safety. That's one way of targeting health policies in your barangay. So let's say, for example, there are many people in your situational analysis in your community. There are many people experiencing diarrhea. There are many people experiencing, food poisoning, and you've seen that there are a lot of, street food vendors. So that's one way of changing or targeting the health policies, the systems that implement health. So you will gather let's say you will propose to your barangay captain and barangay health workers these, let's say, intervention. So why not offer, let's say, a certificate in terms of food safety? So before street vendors can sell their food, they have to undergo this certification program so that they have this idea of how to prepare food safe for consumption, and to prevent the diseases that causes food poisoning, and diseases that can cause diarrhea and the spread of typhoid or even hepatitis. So these are now systems focused practices. So I hope that you're learning from this different population based approach when you go to your community health nursing. Okay, so that's it. That's my portion of lecture for this RLE. Now for your activity, okay, so this will be good. For your activity, I want you to come up with a poster. A poster that shows. So, I know that many of you have, let's say, did some poster making contest before. So now you will do it. It's just you need your bond paper. So it's short bond paper. Using your short, you can also use other materials like Oslo paper, or if you have, let's say, a cartolina, cut it at this with in the size of a short bond paper. Now, what you will do is you will illustrate. You will do a poster. It could be abstract. Of course, I want it to be colorful, so please put some colors on that. And you can use any art material that you would want, but I want it to become a poster. And what you will do is the poster's theme is determinants of health. So what are the factors in the community, in our society, that affects health? So I want you to, like, place there, how do you look at this different determinants of health. Now, once you have done your poster, so I want you to take a picture of that poster, and then I'm going to place the instructions there. So I have here an assignment portion where you can submit the pictures of the posters that you've taken. So I will also place there how you will be graded with your posters. So I'm so excited how you view these different factors that affect health. So my question to you is something for your thoughts, something to think about. Do you think there is health equality, there is social justice in terms of health in the Philippines? So if not, what factors affect that? So please put that in mind when you create your posters. Okay? So thank you so much for listening. This is Moon Cherry, and please do your posters. Okay? So you have the deadline is also there in your description. So thank you so much and goodbye.